So after that incident, I decided to work in the emergency room because I had wanted to work in the emergency when I first graduated. This hospital didn't have a new graduate program, and a lot of the ER hospitals don't. Most hospitals require that you have some experience in another unit before you could work in emergency rooms. So this particular hospital I worked didn't have a newly graduate program for emergency nursing. I'm kind of glad they didn't, because I was able to see both sides of nursing, and I appreciated the fact that I got really good training in the physiology and disease processes within the ICU and all the medications that we had to give. I think if you're an ICU nurse and you want to go into emergency nursing, I think that's an extremely good fit, at least for my personality as well. I like the fast pace of emergency medicine. I worked at what they call a trauma level 1 center. We see patients that had heart attack, stroke, and it's considered trauma 1 because we had the facilities to take care of patients, or the resources to take care of the patients who had a stroke or a heart attack. We had a helicopter. We saw extremely high acute patients as well as non-acute. So I was in the emergency room for about 7-8 years, and I loved it. It's fast paced, and a lot of times what we would do in the emergency room is see to it that the patients are stabilized. We would hand it off to the next unit that they are supposed to go to, whether it be surgery, it's ICU, it's medic surge, or whatever it is. We're kind of the hand-off point. We stabilize the patients and they go to the appropriate units for the next steps. For this unit, I guess we had enough staff where if the patient passed away, I didn't have to place them in the morgue. For me, that was great because that experience really affected me. So not having to do that was great. The number of deaths I saw in the emergency room was less than ICU. One of the things I knew about nursing is that I did not want to be a registered nurse for the rest of my profession. What do I mean by that? Well, I was looking into getting a master's. If you have a bachelor's degree, most of the time you're going to work on the floor, meaning you'll be taking care of patients. And one of the things that I saw that led me to look for other paths as a registered nurse is in other nurses that were working on the unit for multiple decades, really hard on your body because you are standing, you are walking, you have little breaks. It's a very high stress job, and it does take a physical toll in your body. Some of these nurses have no other options and they're stuck in this being a floor nurse, as they call it. Others love it. Others don't want to leave. I know that in the emergency room that I worked in, there were nurses that had been working the night shift for over 2 decades. That's unbelievable to me. It's just not in my mind. One of the things I came to realize is that I liked teaching. I liked mentoring new nurses. There are nurses that become nurse educators. In our emergency room, there were 2 nurse educators. Their job was taking care of the nurses, the different kinds of education that you need. So once you become a nurse, you don't stop learning. There are new procedures, new laws, new facts that come out that you need to have knowledge about. And certifications, you need to get your BLS, basic life support. The nursing educators will manage that and administer these programs that gives you the certificates for the BLS or any other types of certificates you need in order to take care of people in the emergency. There's always constant learning. As a nurse, once you graduate, it doesn't stop. You must continue to learn in order to take care of your patients better. To me, that's not optional. I wanted to become an educator, so I ended up asking these two educators because they went back to school and got their master's in nursing education. And nowadays, you'll see a lot of nurses go into nurse practitioner education, and it's become extremely popular. Go over the nurse practitioner. I think about our profession, there's so many paths of degrees. We really haven't solidified what roles or the scope of practice these degrees hold. And I think it confuses a lot of the nurses that are entering into this profession. And so I'm hoping that what I share with you in terms of my experience, you can get a better picture of what is best for you. I ended up going into Master's of Nursing Education because, first of all, I like the education part of it. And I was thinking that, hey, I want to be able to teach clinical at a university level. The two nurse educators, they had nursing education, and I asked them, well, what is your reason for going into nursing education versus, let's say, family practice nurse practitioner? And their point was that, like myself, they wanted to be educators. They didn't really see themselves more taking care of patients per se, but wanting to educate the new nurses and the nurses that are already there. Well, that's what I wanted to do too. So I got my master's in nursing education. It was difficult to find a school that offered master's in nursing education. I went to Cal State LA. I went there because they were one of the few universities in California that offered nursing education, because every other school programs offered nurse practitioner programs. And I think a lot of times because nurse practitioners make more money, and because they make more money, the programs also can make more money as well. During the Master's in Nursing Education, and that's with all the different master's program in nursing, is that they do give you a course in research. Once I took that class in research, I was hooked on research. That's because as a new grad nurse, you're just wanting to not hurt anyone. Now, at least that's what I made sure that I did not make any mistakes, because that would have been detrimental. I did not want to hurt anyone and make a mistake, particularly a med error, which happens still. And it's understandable because, like I said in the beginning, question everything. Don't take it for granted that people who give you these orders are giving you the right orders. Always triple check. I had an incident when I was in my bachelor's program. I was in a psychiatric unit. And this is a school. I was at the Johns Hopkins, and they were way ahead because they had these workstations that took it to the patient. You brought your meds with the patient. You didn't have to go to a separate location, get your meds. One day, my mentor, these are the meds for patient X. And can you look at the medical chart for this patient and make sure the pills that I have in this cup are the pills that are due to be given. The rule is that you want to make sure you have the right patient and then the right meds. So you'll learn in school what are those checks. Being in school, I'm thinking, okay, I'm going to check the right patient. And so I did. The patient she was telling me about and the patient that she brought up was not the same. There was a moment thinking, should I question my mentor? Because I don't know anything. What if this was a legitimate... I'm ruminating, I'm thinking. And I finally kind of nudged at her because we were about to enter the patient's room. I didn't overtly say this is the wrong patient. I said the patient name and I directed my mentor's view to the monitor, and she realized that it didn't match. So we ended up coming out of the patient's room. That's why it's so important not to not to rely on others. You got to check for yourself. That was like a red flag for me. My goodness, if my mentor could make a mistake, gosh, I could probably make the same mistake and even more. Getting back to my master's in nursing program. So I did find a school. I took a research class and it was the first semester that it was offered and I was hooked. The reason being, because I got sidetracked, was that one of the things that I could not do is take care of many patients, meaning I could only take care of the patient who I saw. I could not take care of all the potential patients that are out there. It really hit home for me because I realized that research can reach out to more people and it could help more people. And that's why I went from my master's program to getting my Doctor of Philosophy, a PhD in nursing. I thought would be the best thing for me. It still is the best thing. And I'm doing these videos also so I can engage with people that are outside of my research. I can still engage with other nurses or other potential nurses who are thinking about becoming a nurse, because it is one of the best decisions I made, becoming a nurse, at least for my personality. I hope the information I provided in this video gives you a little bit more clue in terms of whether you want to become a nurse. Because a lot of times people envision a nursing job as one of those jobs that you can make a good living for yourself, but people don't realize that there is a lot of stress involved and also a lot of confusion in terms of what is the right path that you want to go in becoming a nurse. What kind of certification do you want? There are so many certifications you can get once you become a nurse. You can get certification in your specific specialty. If you are one of those bachelor's program nurses that want to go into nurse anesthesiology, that's available to you. I think nationwide there's only a handful of school, 2 or 3. The nurse anesthesiologists, they make the most money. If I had to do it over again, I might have gone into that program, but I'm also one of those people who have very short attention span. So I either need to be focused on one thing for a short period of time and different things. So for me, that's why I really didn't like the surgery rotation, because a lot of times in, let's say, 6-hour surgery, you might be just standing there handing out equipment and you might be doing other things, but it's 6 hours of being just there, taking care of one patient. I know that was not for me. And labor and delivery was certainly not for me as well. It was quite interesting to see a C-section or a vaginal delivery once. I didn't want to do that as a new grad. However, there are very good new programs for labor and delivery. And if you like that, they used to have sign-up bonuses. I don't see that anymore. I remember seeing $10,000 sometimes for sign-up bonuses for labor and delivery nurse. I have a friend and she went into labor and delivery. She moved on to being a neonatal intensive care nurse. You can go that route as well. There are so many opportunities. If you have any questions, I'll put some links below that gives you information about the different path into getting your registered nursing degree and then your master's program. If you have any questions, please put that in the comments section. I'll try to get back to you. I hope this video was helpful and insightful. If you thought so, please subscribe to my channel. Thank you for watching.